Dr. Timothy Ekpo and physical therapist Adrienne Tawney. Good morning.
Hey.
Good morning.
How are you guys doing?
Good.
Excellent.
Thanks for taking time out of your busy practice schedule to join us.
Always a pleasure to be here. Always.
Yep, my hip's still working good.
Beautiful.
So, it's interesting. We're getting into like super busy sports seasons, and kids are working more than they ever have before, and there are gonna be some injuries. What should a parent do right away if they think their child has a serious injury that needs to be looked at?
Sure. The first thing is I'd say summertime is when we're prepping for the season, right? So you want to make sure you're prepping, getting ready, training, doing all the things that you should do. If I'm a parent and I think that my kid has an injury, first thing I'm going to do is evaluate them, have them evaluated in the emergency room. It's not something that you want to just wait on. Oh, it'll be fine. It'll be fine.
Right.
You certainly want to have it evaluated by the emergency room. If it's non-emergent and it's something that can be addressed as an outpatient, then certainly come by the office and have an evaluation there as well.
One thing I think is cool about MJRI, your team, they've been with you the whole time, from day one. They're loyal, but I think it also speaks to your experience working with Dr. Ekpo. What has it been like?
It's been absolutely wonderful. I mean, even though we've been there just over a year and a half, like the team has grown quite a bit. We've went from one physical therapist, we have 3 therapists in the building.
Oh, wow.
And we all work together very, very well.
I think when you first started, you were sending people, different places for physical therapy. No, you're doing everything now in-house, right?
Yeah, it's been really great. We've grown substantially. So we see our own patients for joint replacement surgery, but we've expanded that. Adrienne and her team have just been instrumental in being able to take care of patients, whether it be hip, knee. Now we're seeing a lot of shoulder and back, and so we're completely open to seeing patients from outside of our own practice.
Tell us about some of the therapies and techniques that you use.
With the therapies, we do our own assessment when patients come from day one. We look and see their movement patterns, how they're moving, how strong they are. Every patient gets a home program on their first day.
Oh, nice.
But with our own assessment, we're seeing what we need to do when that patient comes to our clinic. Every single patient that comes in gets some sort of soft tissue work. They're getting manually stretched. Anything, if they need to do any pain modalities, we're doing pain modalities while they're there. And they're there for a good chunk of time. Patients are generally there for about an hour.
Okay. How rewarding is it, after, maybe a couple months of therapy, and just in your patients, they really start to feel better, and it is life-changing for them.
Yeah, I mean, it's great. I mean, you have knee patients who they knew they needed a joint replacement a long time ago, and they haven't been able to do stairs the right way in 5 years. And by the time they're done in therapy, and generally with that Jiffy knee, they're done in about 6 weeks, and they're doing stairs the right way, where they haven't done it in 5 years like that.
I was at Disney World recently, and there were about 500,000 people that could have seen you for some type of procedure. The way people are walking around that place, I assure you.
What's funny is, when I'm out in public, I try and take my surgeon hat off, but it just stays on all the time, and I'm evaluating the gait and the way people walk. I'm like, oh, that's a bad knee, that's a bad hip, and you want to say, here's my card, come see me. I'd be happy to help you in any way, but. It's just one of those things you can't unsee it once you've corrected it so many times.
But the thing is, and people don't have to live with this pain.
You don't.
You guys, post-surgery therapy is really important, but you guys are into this prehab, getting people ready for surgery, but getting their everything all prime condition so that the post-surgery rehab goes a lot smoother.
Yes. We have a therapist that will go into the joint camp now and give patients their exercises before they even have their joint replaced.
It makes a big difference. There are people that they kind of blow that off, and they regret it, don't they?
I think they do. I think prehab is just one of those things that just kind of gets overlooked, and sometimes home exercises is one of those things that just kind of gets overlooked. I can't understate how important it is for you to get ready and get prepped, just like you would with any other medical issue. Same thing happens with physical therapy. You want to get ready and get prepped for this joint replacement, so it makes the recovery much easier on the back end.
Yeah, it seems like stretching used to be just so much bigger than it is now, and it's like, you know, hey, why aren't we stretching? That is as important as anything when it comes to being prepared to work out.
Yeah.
Yeah, and isn't pickleball great?
Don't stretch. We've got a quick little clip of course, Dr. Ekpo and MJR, a great sponsor of high school football on JTV. Let's take a quick look.
So 8 minutes to play. Second down. Ball's on the ground. Jackson High will recover.
No, that's a change of possession.
So the clock should stop here, but you know what, Dan? Dr. Ekpo says the ball is going the other way. Look at that turnover belt there, thanks to Dr. Timothy Ekpo and the Michigan Joint Replacement Institute. It's quite the wardrobe there with the belt, man.
I love it. I want to go to him just because of that.
Just to see the belt.
Yeah.
So he faked the throw, and then the lineman shake hands.
I like that.
I
like
love
that.
it.
I like
Turnover
that
belt.
outfit.
We're gonna get one
I
of
love
these
it.
going on.
I love it. It's funny watching the kids growing up nowadays. They do all these media day things, and so the chains and the belts and the sunglasses falls right in line with what these kids are doing. So
I
funny.
agree. It's really cool to kind of see the evolution of, you know, from high school to college, and now you have all the NIL things, and so yeah, I agree.
It's cool.
Your practice has grown, and not just in the building, you're filling up the whole building now, but you are attracting people from all over the Midwest for surgeries. What is it about, what do you think it is about your practice that gets people to travel 50 or 80 miles?
I'd like to say it's the people that we work with. You know, it's people like Adrienne and all the staff that we have that create an experience that patients can really relate to. Certainly, we do a great job. We try and do our absolute best with surgery, and we provide some unique things like a Jiffy knee procedure. But I think the overall experience is what patients are expecting and getting, and they go back and they tell their friends about that. And you know, patients are coming from as far as Alaska, you know, to have joint replacements, and so it's very gratifying to know that our staff and our team does a great job taking care of patients.
Really just treating people well too.
Absolutely.
Yeah, it's awesome.
Well, you're so publicly reviewed. You know, you search your name, and that's what I know is probably responsible for a lot what patients have said and are willing to post and rate on the internet.
Yeah. When you treat patients like you would your own family member, when you treat patients with in a humane way, and it's, you know, not just a number, and you treat them like I said, you would your own family member, I think that resonates with a lot of people. You explain things a certain way, and it votes well.
Yeah, and I think the staff feels that way too, as do the patients.
We do. It's great there.
Great to have you both here. Thanks for coming in today.
Thank you for having us.
Thank you, guys.
Thank you.
Thanks for your support of JTV and sponsorship of high school sports. We're excited about this season starting tomorrow.
Can't wait to see that turnover belt.
Yeah, a lot of turnovers tomorrow night, I'll tell you that.
Dr. Tim Ekpo and PT Adrienne Tawney from Michigan Joint Replacement Institute. More in the morning show after this.